The Kistefos Isilimela HIV/AIDS Action Program was designed to meet the needs of communities affected by HIV in the Oliver Tambo district of the Eastern Cape province. Funded by Kistefos, the holistic program focused on preventing HIV and providing treatment, care and support for people living with HIV and TB, including pediatric and mother antiretroviral treatment, or ART, and prevention of mother-to-child transmission, PMTCT. Specially trained community healthcare workers, or CHWs, were tasked with tracing defaulting patients, early detection of HIV and TB, encouraging male partners of pregnant women to be tested for HIV, and mobilizing their communities. The program had many highlights, including improved early detection of HIV infection in pregnant women and babies, thereby saving their lives. With a focus on PMTCT and provision of ART to pregnant women, mothers and children, we succeeded in decreasing the rate of mother-to-child transmission of HIV to 3% and at some clinics to 0%. Vegetable gardens were established, children were tested and treated for TB and HIV, and more newborns with HIV were initiated onto ART within 2 weeks of being born, saving their lives. The number of community healthcare workers taken on to the Department of Health and government payroll increased to 108 people. The project placed 16 porter cabins as an extra space for confidential HIV counseling and testing, or HCT, increasing the number of people tested and treated for HIV. Owing to the success of this first phase, we extended our program into its second phase. We also implemented several highly effective methodologies. Clinic community training saw the development of a training manual and approval of a provincial policy for clinic committees, which empowered community members to govern health services in their individual areas. The patient file management system underwent a restructuring, with file audits, improved capturing of patient attendance, tracing and follow-up of defaulting patients. In 2017, community healthcare workers were trained in the Skills to Care methodology, a learning program designed to improve and test their knowledge and skills. A dynamic addition to the community healthcare workers' arsenal was the development of a tracking system called the SMS Lifeline system. With this system, CHWs can effectively return patients to care through SMSs, telephone calls and home visits. CHWs and nurses were then trained in the art of growth monitoring, including the provision and use of the MUAC tape and specially made baby scale. CHWs have also been trained in maternal mental health, which is a powerful defense against HIV. By ensuring that pregnant women and mothers are able to cope emotionally and psychologically, CHWs are able to pick up when a mother might default from her treatment. To tackle the issue of gender-based violence, absenteeism and teenage pregnancy, SPF implemented our UN award-winning methodology, Bright Futures, into 90 neighboring schools. With age-appropriate lessons on puberty, family planning, consent and education, young women were encouraged to develop a vision for their futures and to build the confidence to succeed in finishing school and finding a job. As part of Phase 2, we also developed Kistefos Education Program to address the academic difficulties faced by schools in the Eastern Cape. The program employed a holistic focus with academic mentorship, improved reading methodology, conclusion. By empowering people young and old with knowledge and psychosocial support systems, the Kistefos programs, in all their many multifaceted incarnations, have built a foundation for improved health systems, care and education. Not only are these programs sustainable, their efficacy and flexibility lends itself to replication, and with further study and testing, SPF, together with Kistefos, will refine and expand what is already proving to be a victorious moment in the fight against HIV and AIDS in South Africa.